Hey guys, I'm Dr. Eric Gifford with Evolution Health and Wellness Center. Today we're going to do a demonstration of hormone pellet placement. My lovely model here is my wife, so I can call her that. And she has done pellets for the last year or so. This will be her 5th pellet placement. We bump her up with a little bit of testosterone and really just keeps her vibrant and going. But today we're going to demonstrate how we put the pellet in. It's a really simple procedure, but some people are a little scared of it. But I'm going to show you how easy it is and how well she tolerates it, because she does not like needles, but she tolerates this very easy. All right, we're going to get started here in a second. All right, to start, all we're going to do is clean the area. We usually go just up above the, just below the waistline, just on the buttock. There's usually a little fatty tissue that we put the pellet into. So very simple. I made a little mark on her skin. We're going to clean it. Again, I just use alcohol. You can use chlorhexidine, you can use betadine, you can use lots of things, but in all honesty, alcohol still cleans it, and we have never had an infection. So easy to use. So this is just lidocaine, 1%. This is the only part that you really feel. You'll feel a little stick and a little burn. Here we go, 1, 2, 3. There you go. Now my wife will tell me that I'm torturing her, but this is just a little lidocaine. This just makes it so you don't feel the rest of the procedure hardly at all. And then we're going to make a little track. So we're going to go up where we're going to put the pellet. And that's where we're going to put the most of the lidocaine. Again, you'll usually feel a little pressure, but shouldn't feel much more than that. Okay, that was it. All right, so next I'm going to go ahead and put some sterile gloves on, and then I'll show you the whole kit that we use, and we'll get the pellets placed. So she's numb, and this is just an 11-blade scalpel. We're going to make a tiny little puncture hole so that we can push the trocar and the pellets in. So again, she's really numb. She shouldn't feel any of this. We just make a tiny little incision. That was it. We then take the trocar. This is what this is. And we will place that just under the skin. Again, sometimes she'll feel a little bit of pressure, but she really shouldn't feel much pain. All right, so we're going to put the smallest pellet in first. So in women, this is a simple single push. In men, we actually do several pellets, and so it actually, we have to put it in several different places, all through one entry point, just multiple pellets. So this is it. And we're done. That was it. So very simple. And now we're going to put a steri strip over the incision. We're going to first use a little benzoin, which is just extra sticky, and that will make sure that the steri strip stays in place. We want it to stay on for about 3 to 5 days. But you saw how easy that was. That's all there is to it. So this is a Tegaderm bandage, which is waterproof. And this allows that steri strip to stay in place. Allows you to take a shower. You can absolutely get this wet. We do not recommend soaking. So no baths or hot tubs or swimming pools for at least, in women, 3 to 5 days to let that thing close up. We'll get some air out. Okay, and that's it. So she is done, and we're going to pull this all back together. So again, you can see that that was a very simple process. She didn't scream or yell. She tolerated it very well. And if you were interested in this, we would love to consult with you and talk about how we could help you with your hormone optimization.